this workshop is on the management of a latent TB infection. The World Health Organization has estimated that 2 billion people, which is 1/4 of the world's population, are infected with TB worldwide. And this is what we refer to as latent TB infection, or LTBI in short. The World Health Organization has recommended the use of shorter treatment regimens that have been proved through various studies to be associated with higher completion rates, lower toxicity level, and have been found to be non-inferior to other LTBI treatment regimens. So this workshop we are doing today will outline our local clinical guidance for the rollout and the use of short-course latent TB infection treatment. This will be focused mainly on 3-HP. And 3-HP is a once-weekly isoniazid and rifampicin regimen for 12 weeks. This is one of the of the alternative shorter regimens recommended by the World Health Organization. So what are we aiming to achieve with this workshop? We would like colleagues to highlight strategies and guidelines for the control of tuberculosis through the treatment of latent TB infection. And we hope by the end of today, colleagues, that we would have provided you with the basic knowledge and skills to effectively manage individuals with latent TB infection using the local or the recommended latent TB infection treatment regimens that we are going to discuss today. In terms of learning outcomes, by the end of the training, we expect that you will be able to describe the pathophysiology of latent TB infection. You would also be able to explain the differences between latent TB infection, or LTBI in short, and active TB disease. We are expecting that we would all be able to explain how TB is diagnosed and excluded prior to initiating treatment with latent TB infection treatment. We also expect that we would all be able to describe the available options for treatment of LTBI in South Africa. We also need to ensure that we can identify individuals who are eligible for latent TB infection treatment with a focus on isoniazid preventive treatment, in short IPT, and the newer short regimen 3-HP. We also need to be able, colleagues, by the end to identify those individuals who should be excluded from latent TB infection treatment. We also need to be clear about how and what we need to prescribe and how to administer the regimens we are going to cover today. We also need to be clear about identifying side effects. We must know the side effects and we must anticipate them and know how to manage them, and also how to manage the adverse reactions should they occur during the course of a latent TB infection treatment. Lastly, colleagues, we expect that by the end, all of us will be able to monitor individuals who are initiated on the regimens that are available to us. How do we aim to do this? Colleagues, as Dr. Mawela already mentioned before, we were planning to do the workshops face-to-face, but now that has been curtailed by COVID-19. But the way the course is designed is to be able to do such face-to-face workshop at designated venues. We also could, as we are doing now, provide a series of virtual live webinars to relay the information and to interact with you, colleagues, and discuss the material at hand. We also have an e-learning platform or an e-learning course, which is supported by experienced instructors, hosted on an e-learning platform with case studies, simulations, video lectures, and discussions. So colleagues, in addition to what we are doing today, which is a virtual training, there is also an e-learning course that is available and can be completed on the e-learning management system. The e-learning course enhances knowledge acquisitions and skills development by allowing learners to view or to review pre-recorded lectures and download guidelines and job aids. Dr. Mawela is going to share more about this later on in the workshop. For the purposes of today's workshop, we are expecting that we should be able to complete it within the next 4 to 6 hours. And that is what we are aiming with the courses, with all the platforms that we are implementing, that in 4 to 6 hours, we should be completed. In terms of assessment, colleagues, as participants, you'll be required, or participants will be required to attend and participate in virtual live webinars like this one we are conducting currently. Participants can also access pre-recorded lectures, which will be made available for poor network areas. So colleagues, in terms of what we are doing today, if there should be any issue with connectivity or the quality of audio, we do have pre-recorded lectures available that one can download and access and go through them even at their own pace. The e-learning platform is also available. It is enabled for continuous learner assessment through pre and post-test, checking and tracking your completion of modules. The e-learning platform also provides graded exercises, simulations, case discussions, and course evaluations. So colleagues, in short, this is what is available to us, and the e-learning platform supports what we are currently engaged with. For certification purposes, colleagues, for you to qualify for a certificate of completion, participants should have attended the virtual live webinar and completed the assessment on the e-learning course. The learner should pass the test, the exercises, case studies, and complete the course evaluation. And this course, colleagues, will be accredited for clinical CPD point according to the Health Professions Council's Medical and Dental Board guidelines for healthcare professionals. Colleagues, I'm going to stop there and hand over to Dr. Mawela.